It will be essentially touch the pillars of our health: access to safe water, access to food, access to clean air. And if those three ones are at risk, obviously our health is going to suffer. In addition to that, it will generate better conditions for some vectors like mosquitoes to transmit diseases that are very much related to those meteorological conditions. Now, there are plenty of good opportunities as well, health benefits that can be obtained from those strategies to reduce, to tackle climate change. And this is where we need to be convincing people that whatever they do to tackle and to combat climate change will have a benefit on our health as well. Unfortunately, yes. Obviously, if you are poor, if you live in a country where the resources are very limited, you will be much more affected. Those countries where there is not a very strong health system that will be able to cope with those diseases that will be exacerbated by the occurrence of global warming, you will be more at risk. Or you will be more at risk because the infrastructure and the preparedness and all of that to floodings, to natural disasters. And of course, you will not have the capacity to cope with on time on the issue of air pollution, for instance, that is generated and very much linked as well to the causes of climate change. Yes, they can be mitigated, and this is the most important message, I will say. That's why we call the Paris Agreement, the COP Agreement, a public health treaty, because in fact, if you put in place all the measures you need to put in place to mitigate climate change, to tackle the causes of climate change, a more sustainable transport system, a low carbon economy, reducing the dependence on energy sources which are not clean. If you reduce air pollution, there will be enormous health benefits that can be obtained. And this is why we want them to be aware of how much is important to invest on good interventions to combat climate change in order to generate health benefits. If we do a healthy urban planning, a healthy urbanization, it can be an opportunity. At the urban level, you can take a lot of measures to create spaces where people is able to walk, is able to cycle, is able to have a more active lifestyle instead of the sedentary lifestyle that somehow our cities are forcing us to have. If we tackle and you plan properly the transport, the public transport system, the one that will reduce traffic and traffic injuries and air pollution, then you will be doing a good for health. But if you don't plan keeping health in mind, urbanization can be a major problem for our health.